So thank you everyone to join us here today, virtually and online from different parts of the world. My name is Sanaa Alimia. I'm an assistant professor based at the Institute for the Study of Muslim Civilisations at the Aga Khan University. And we're hosting a series of events and talks, as you well know, that are part of the Bloomsbury Pakistan series and hosted in conjunction with the Institute for the Study of Muslim Civilisations, that are looking at Pakistan's responses to crises. And in today's discussion and session, we'll be tackling the question of mobility and migration and how that's been affected with regards to the current pandemic that we are all in the midst of, and in particular how it's affected a particular region in Pakistan, Khyber Pakhtunkhwa area and the former federally administered tribal areas, which are now part of the Khyber Pakhtunkhwa region. And I'm very glad and very honored to be joined by two brilliant academics and two brilliant scholars who have been very important figures in my own life as mentors and as people who I've learnt a lot from during my own time at the University of Peshawar in the Department of Political Science. So I'd like to welcome Dr. Shahida Aman and Dr. Noreen Naseer, who are here with us today. I'll give you a brief bit of information about them, and then I'll just do a brief introduction. And the way that the session will work today is that I will start off with some introductory questions to our colleagues about the topic that we're discussing here today, and we will have an in-conversation, and then we will shift and open up the questions and discussions to the rest of our audience members who are joining us from across the world. So allow me to first introduce Dr. Shahida Aman, who is working as an assistant professor at the Department of Political Science at the University of Peshawar. She holds a PhD, from the Area Study Center in the University of Peshawar as well, and has authored a number of research articles and publications. Her main research area focuses on electoral politics and Pakhtun women, women and militancy, youth radicalization, and failed states, and post-conflict societies, and primarily in the Afghanistan-Pakistan region. She's also worked on a number of other topics, including youth radicalization and governance in the former tribal areas. And she's been involved in a number of research projects in and outside of the university, and is, of course, a very popular one of the faculty members amongst students and staff at the university as well. And Dr. Noreen, who I'm really honored that you're joining us today, is a resident of Kurum district, the newly merged tribal district of Khyber Pakhtunkhwa, and is also a faculty member of the Department of Political Science in the University of Peshawar. She's worked on a number of really, really important issues, both in her political and, both in political science department, but also outside of this in grassroots organizations, looking at the questions that are facing tribal societies and women within the region as well. She has been a patron and founding member of Kabili Khor, the Tribal Sisters Network. She's a founding member and a vice president of the Khor organization, and she has also assisted the Khabile Khwande, Brave Tribal Women, and Khwande Khor on a project for tribal women. She is a resource person for third-party approaches to worldview conflicts, hosted by the Culture and Religion and Mediation for the Center of Security Studies in Zurich, and is a part of a number of other programs, particularly related to women and security in the region. And of course, she is somebody who has published in a number of journals, international journals, and has also been nominated for the N-Peace Untold Stories Award by the UN Development Program in 2018. So we're really glad that you are able to join us here, both of you. And thank you for allowing me to get the formal part of the introductions over. And I'm hoping that we can shift on to more interesting parts of the discussion as well, that bring out these insights from your work as well today. So the question of migration, of course, is one that is central to our understandings of how states and societies are made and how they function. And the question of mobility, of course, is also a very important part of how local societies and local economies function. Pakistan, of course, has a very long history with migration, and much of the academic scholarship within the remit of migration, as well as public discourse, has tended to congregate around the idea of course, 1947 and the events thereafter that were very foundational to the state as we know it and understand it today. But of course, a lot of migration has continued on in Pakistan, into Pakistan, since this initial formation period. And much of this migration into Pakistan has, of course, taken place within the Khyber Pakhtunkhwa areas, particularly after the 1970s and in the 1980s with the Soviet invasion of Afghanistan, where the region became one of the highest hosts to Afghan nationals who were categorized either as refugees or undocumented migrants. Khyber Pakhtunkhwa also has another history with migration, of course, and mobilities that are shaped by it being one of the regions that sends most demographic, in terms of demographics and population numbers. Whilst Khyber Pakhtunkhwa is around about 20 million or so of Pakistan's population, it actually sends 25% of its foreign labor force, of Pakistan's entire labor force, as labor migrants to foreign states, including the Gulf Arab states, of course. So there is a long presence, I guess, of migrants or people moving in mobility and transnational mobility circuits from the region, particularly to the Gulf Arab states, where middle class and lower middle class and rural migrations are taking place for work. And you have daily flights, of course, from the airport in Peshawar, where people are going from Emirates Airline or Etihad Airlines or other smaller airlines to serve the Gulf labor market as well. And of course, you also have an internal labor migrant story that is part of Khyber Pakhtunkhwa and the region, and of course the tribal areas that is related to war, conflict, displacement from natural disasters or disasters that haven't been managed so well by central government authorities. And you also, of course, have a very important rural urban migration in terms of people migrating from rural areas to the city centres and serving the cities in terms of domestic labourers or in terms of daily labourers. So, people moving from Sawabi into Peshawar to kind of work as wage labourers or to clean houses or to do these types of drivers and various activities. And you also, of course, have the fact that KP is also a migrant sending area and region to other parts and other cities within Pakistan as well, including Islamabad, Karachi, and the like. So I'm hoping that in the course of the session that we have today and the discussions and your expertise, that we can just touch on some of these themes and tie it into what's happening in the current moment with the pandemic. So some of the themes to think about are how has the pandemic affected the regional and local migrant labor flows? And how are labor migrants in particular affected, both those who are moving to the Gulf states, but also within local and national kind of like spaces. And the other question, and of course this will affect both men, and it will also affect women as well who are migrating. So if we can also have a think about that from that perspective. And then of course I know that Dr. Noreen Naseer has also focused on Afghan conflict, on Afghan women and domestic violence. And I'm wondering if there is something that you could kind of give us an insight into what is the position particularly of vulnerable groups who are not classified as citizens and therefore don't have legal protection, so to say, in the formal sense. And how is it that people who are vulnerable within that group are particularly affected? So I'm hoping that these are some of the things that we'll be able to touch upon in the session and in today's discussion. But before we kind of get onto that, I was wondering if I could turn to both of you just to give us a general introduction as to what the situation is like in KP at the moment, particularly with regards to the pandemic, and just a general kind of introduction to the situation and an introduction to yourselves, if you will, please. Thank you. So I'll pass over first to Dr. Noreen. Thank you.
Okay, thank you, Sanaa. I'm sorry for being late. I don't know what happened to my computer, I believe so. Now, it was very, I would say, traumatic for the province, Khyber Pakhtunkhwa, and of course the newly merged tribal district. As you know that in 2018, these tribal areas were merged with KP, and the KP is now has enormous responsibilities towards this newly merged tribal district in terms of extension of the judiciary and police and, of course, other institutions. If you ask me that what happened during this period when this lockdown started, I think they were least concerned about the pandemic. I think the communities displaced, or even the people of Khyber Pakhtunkhwa, when the lockdown started, I think the real problem started with the lockdown. And we saw that most of the jobs were shut down, shops were shut down. And as you mentioned, that Peshawar is a city where it is brimming with every kind of displaced population, either whether it's Afghan refugees or tribal, internally displaced people, people from Swat. You see them. You see almost every community hit by the war or conflict is somehow residing in one or another district of Khyber Pakhtunkhwa, and specifically in Peshawar, as it's a capital city and it has a huge heart, I would say that, and it encompasses everybody. So when the lockdown started, it started hitting everybody, including the people living within Peshawar city or in Peshawar and in these districts, settled district, other settled district, the migrant, whether they are refugees from Afghanistan or internally displaced people of tribal district, or even from Swat. With the jobs shutting down, and somehow the government was not even prepared. The response of the government was very poor in that regard. And when you would go out for your own groceries, like this is my own, before going into and doing the research, and as I'm also affiliated with a different charity organization. I also run my own charity organization. So when we would go out, and you will find people on the roads, these daily wages, sitting and waiting for any kind of help. So as a small NGO, it was not possible for me to target every area, because our target is mostly the tribal districts or the tribal areas or the tribal people that we know of. But in this pandemic, in this situation, in the lockdown, we reached out to anyone who is available and who is visible for the help. So we extended that help. So what I have observed, that the government was not ready for this whole situation, this pandemic. Then when I was assigned, because then we were sitting and discussing as a charity organization, we needed to, we felt this need that there should be some homework done on these vulnerable communities, as well as women specifically. As I'm heading a women organization, more concerned about the women and children. And as they were not very visible, because you don't see women very visible, it's always the men who are around on the roads asking for help, but you don't see women. So we felt the need that there should be we need some strategy. And for that, we needed that survey. And then we conducted a survey. And during that survey, we found out that there is an increased gender-based violence. Mm-hmm. Like pandemic was not that severe as the gender-based violence was. So this is how I see, and we observed, and then that's how I embarked upon this research study, that we should then, and then of course, with a gender-based violence, we came to know about it, that what were the major reasons, like many of the men were jobless, mm-hmm. Many of the women were jobless, and they were sitting at home, anxiety, trauma, and of not having any available job or food. This was something which triggered, I would say, it disturbed the whole household. And that's why we saw the increase. And I have some statistic later on, we can share it. But the impact of what I felt, because when I was doing the research and we were doing this, it was basically, a rapid sort of a domestic violence survey, because we simply could not reach out to every community or every place. But when I was doing, as you know, I myself is a sort of an economic migrant to Peshawar city. So I felt, and as working with these communities so closely. So although it was whole KP, but my focus was also on the refugees and internally displaced people. And I felt that they were disproportionately treated. And women who often form this majority of the displaced population in conflict were affected many-fold as compared to men. And these women access to the services and ability to feed their families, as you know, is already compromised because they are displaced in a different, they are completely in a foreign place or a foreign land. For them, Peshawar is a foreign land. If they are moving from North Waziristan or from South Waziristan or from Khurram or from Bajawar or even from Khost and Paktia, for them, Peshawar is a foreign land. They were already compromised. They were already vulnerable to so many other, I would say, sexual violence, abuse, and other, I would say, problems. But this COVID situation, this pandemic, and specifically the lockdown, it affected them adversely. And these women, as I said, access and that they were exposed to every kind of sexual exploitation and abuse, and with their rehabilitation or integration back into the community, as you know, what is the priority of the government? It's a low priority. And that's why for the last 10 years, they are displaced and living in different cities of the KP and Punjab and even in Karachi and in Sindh or in Balochistan. And above all, the indifference of the government, specifically in the Ehsaas program, there was no specific program for these women. In the Ehsaas program, there was nothing to address the displaced people. And when we were searching for this data, and we were talking to these people. Even I was talking to these people from UNHCR as their offices were closed. So it was very difficult for the refugees women to reach out to them. And that also, I would say, that increased the domestic violence within their households. They were insecure within their own houses. So that's why I felt that there should have some quick responses of the government towards these marginalized or vulnerable people in, I would say, women and children. But somehow, as you know, that the government had so many excuses, and one of the excuses was that they are lacking funds and other facilities.
This is something that we've spoken about before, isn't it? In terms of the fact that I'm saying before to those of the people who are listening in, of course, we've had a few of these conversations before where it is the case where these vulnerable groups, effectively what you're saying, in best of circumstances, are vulnerable enough as it is, but the pandemic, of course, and in moments of crisis, if you're looking at kind of like who is kind of being supported or not supported, those who do not legally belong, and of course this will be mediated by I'm assuming also by class as well, but those who do not legally belong or those who are in a displaced situation end up being in even a more vulnerable position. Dr. Shahida, can I bring you in as well to the conversation? And
of course,
is what Dr. Noreen saying, does this reflect well with what you have also seen and understood from what's taking place on the ground as well? And just generally your understanding of the pandemic too.
Thank you very much, Dr. Sanaa Alimia, for providing us with this opportunity to talk to this august body, especially from the very prestigious platform of Khan University's Institute for the Study of Muslim Civilisations and Bloomsbury, Pakistan. Now, thank you also. I want to thank you also for the very generous introduction. Before I come to the topic of how migrant workers were influenced due to COVID-19 situation, let me give you just a brief introduction about the coronavirus pandemic in Pakistan. Now, just to put the things in perspective, because it would be easier for us to, to see the broader developments appropriately if we bring out certain important points. Now, the very first official case of COVID-19 was recorded in Pakistan from Karachi. It was 6 months ago, and the date was February 26, 2020. and a strict lockdown of business and education institutions. It started from mid-March onwards. Now, the government, after almost 5 to 6 months, since last month, since August, has started to open up businesses, factories, and also education institutions. As of today, Pakistan has had more than 0.3 million confirmed corona cases. As far as today's figures are concerned, there are 7,388 active cases, and the reported deaths out of these 0.3 million confirmed cases have been 6,437. Now, while we are analyzing the situation or the impact of COVID-19 on Pakistan, it needs to be remembered that Pakistan's population, almost 1/3 of it already lives below the poverty line. And this pandemic has hit Pakistan in a year when people are trying to recover from drought, from floods, and from locust-related shocks. Now, since already Pakistan's socioeconomic parameters are not that encouraging, therefore, the pandemic has further raised the levels of food insecurity among the populations. It is estimated, I'll just give you a figure of the former federally administered tribal areas, FATA, former districts of FATA, agencies of FATA, which are now a part of Khyber Pakhtunkhwa province. It is said and it is estimated that almost 35% of the total population in FATA are facing food insecurity. And this is on top of the fact that Khyber Pakhtunkhwa province and FATA have suffered disproportionately from the impact of last several decades, I would say, not just 2 decades of a prolonged conflict, terrorism, and military operations, etc., and displacements, etc. Now, since the socioeconomic indicators of Khyber Pakhtunkhwa and former FATA are already on a very low scale as compared to the national average, that is why the pandemic made things worse for the people of this particular region. Now, of course, the whole of economy Pakistan has suffered and still is suffering, as we can understand that there are several worsening projections for the economy of Pakistan. For example, it is estimated that the unemployment record has climbed and will be climbing to a whopping 28%. The GDP growth rates of Pakistan have already climbed down to -1. The fiscal deficit is almost 10%. And all of this, of course, has come at a time when Pakistan's health system is already overstretched due to the onset of the coronavirus pandemic. As far as the pandemic's impact on the internal and overseas migrant workers are concerned, do you want me to speak now, or should I wait?
Yeah, I think actually, since you're kind of in the thing, I think it would be great to hear about that. Yeah. Yeah.
Okay. Now, before I discuss, of course, the impact on the coronavirus's impact on internal and overseas migrant workers, let me share with you some essential data. Out of a total of around 62 million employed workers in Pakistan, more than 8 million workers are migrant workers, which means that they have to travel within Pakistan almost on a daily basis to earn their living in big cities. In Khyber Pakhtunkhwa, which also includes now FATA, the former FATA region, out of a total of 7 million employed workers, there are around 1.5 million migrant workers. And these are internal migrant workers I'm talking about. Now, besides these internal migrant workers, there are almost 11 million overseas Pakistani migrant workers working in different countries of the world. Some of the figures you already have mentioned about it. And as you were also mentioning, and this fact remains, that one of the biggest cohort of the migrant workers, overseas migrant workers, is based in Saudi Arabia, in UAE, and the rest of the Gulf. Now, let's come to the impact which internal migrants had to face because of the coronavirus impact. Now, I already mentioned to you that the lockdowns began in mid-March 2020. And as lockdowns began, definitely there was a closure of business activities, transport services, construction industry, factories, as well as schools. This meant that around half of the migrant workers in Pakistan and in Khyber Pakhtunkhwa, which again I'll emphasize inclusive of the former FATA region, were either laid off immediately or are still in the process of being laid off. Now, on the outside, it seems that the internal migrants suffered a similar fate as far as COVID-19 and impacts are concerned. But if we go in deep into this topic and talk to the migrant workers who suffered as a result of this pandemic, then we come to realize that there are many finer points to it. First of all, it's very essential to realize that most of the migrant workers who have been laid off, they belong to informal sectors of the economy. And of course, when we say informal sectors of the economy, then it means that they already had very little access to social security coverage from their respective companies or owners. And it is said that it is estimated that almost 45% of the migrant labor is involved in informal sector. So on the one hand, they're already involved in the informal sector, which is offering them very little social security. And on the other hand, they were also, half of them were also devoid of their jobs, or they were laid off from their jobs, especially the daily wage earners, which made life very, very difficult for them. The second important thing is that these internal migrant workers, depending on their professions, either suffered partial or full layoffs. But at the same time, another interesting dimension is that there were several others who incurred additional costs for keeping their jobs. In other words, they kept their jobs, but with additional costs. For example, for those in the teaching occupation, online classes meant that they were able to somehow manage to retain their jobs. Similarly, technicians and workers associated with hospitals, clinics, etc., did get to retain their jobs, but incurred additional financial burden as well as time constraint burden. There was a travel restriction. They had to.
Sorry, can I just ask, what were the extra financial costs that they had? Is this in terms of infrastructure and kind of having to buy stuff?
Let me explain it to you. Now, previously they used to go in public transport to their workplaces, and public transport meant that a huge bus would be carrying them 20, 25, 30, 50 passengers at a time, which meant that they had to pay, let's say, 50 rupees to 100 rupees to fly from one town to another. Now, as the roads were closed and public transport was off the roads, what happened was that they still had to go to their jobs. So they hired private cars, and they had to go through, unfrequented routes. Those routes which took them longer to reach because main roads were closed. They were not supposed to fly on that. They had to take private cars, and they had to go through unfrequented routes. So it meant that that additional financial burden was placed on them, and also that additional financial time constraint was there. Now, another aspect, a third aspect which I found through the different conversations that I had was that of the return migrants. Now, return migrations or migrants means those migrants who are working outside of the towns, but as the COVID-19 pandemic began, they had to return to their hometowns. Now, return migrations were encouraged as a result of this pandemic, not only because the businesses were closing down, the workplaces were closing down, but also because of the fact, as Dr. Noreen pointed out, that the social security protection provided by Asas program of the government of Pakistan, it stipulated that they needed to get registration in their own hometowns and districts in order to be able to get stipend from the government. So this was one aspect which came to the fore. And of course, as these return migrations, which we call them, return migrations were taking place, these return migrants carried with them the stigma of maybe carrying the deadly virus from the cities to their towns. And definitely they were subject to additional checks on the entry points of districts. They were made to quarantine for 2 weeks, often in camps and shelter spaces at the very border points by this district administration before they could return to their families. And many of them unfortunately returned after salvaging whatever savings they had, and they were forced to live on that. Now, another important interesting aspect is that As far as the return migrations among the temporarily displaced persons were concerned, it was found that they were more vulnerable to the COVID-19 adverse impact because due to being displaced from their hometowns, they lacked the social protection of an extended family or tribal network, which other migrant workers had, and which in turn helped those other workers to survive through the financially trying times. So temporarily displaced persons here were again, I would say, doubly disadvantaged in terms of this pandemic's negative influences on their lives and livelihoods. Coming to the overseas migrants, the impact on overseas migrants, of course, as pointed out by Dr. Sanaa, that most of the Pakhtun diaspora migrants in the Gulf, especially, they are serving in semi-skilled or unskilled jobs. And among these migrants, which number at several million, almost 0.5 million belong to the formal tribal agencies. That is the agencies which are now districts of Khyber Pakhtunkhwa province. Now, again, I would say that the impact which COVID-19 had on these particular set of overseas migrants would be carrying different dynamics. For example, first of all, when the lockdown began in mid-March 2020, the flights were still operational. So hundreds of thousands attempted to return home. Now, this return journey of the migrants was replete with many challenges. For example, the airfare, which cost them usually 50,000 Pakistani rupee, it tripled to around 200,000 or more, even when they were traveling by Pakistan International Airlines. And when they returned, of course, since they had traveled internationally, and since they were also carrying the stigma that they may be having that virus with them, they were forced to quarantine in private hotels. Now, they were forced to quarantine in private hotels before they could return to their homes, and definitely they had to pay the bill of those private hotels. So this was, again, I would say, additional burden on these particular set of overseas migrations who were returning home. Now, if we look at the nature of...
Dr. Shahida, is it okay if I can just bring in, because I can see Dr. Noreen is kind of nodding along here as well. And I was just wondering if I could bring Dr. Noreen in here as well, because I think, of course, both of you are touching on these quite similar and important themes. And I think one of the things that is striking me quite, strikingly, is this very notion of kind of having to quarantine and having quarantine camps, and of course the social structures of these various kind of groups of people, of not being able to have the full support networks that are available there. And I was just wondering, Dr. Noreen, if you could say something in response to Dr. Shahida in terms of this quarantine process, and also the social support networks that seem to be not that significantly in place for particularly groups who have been displaced from these regions. Perhaps you can add something to what Dr. Shahida is saying here.
What I like, there are, government also had tried, like the government response was that like it was for the regular travelers who travel through air or through bus, and then they were carrying passports. So these regulations were applied to these people. And in the beginning, it was not even applicable to these people. And that's why there was this debate that normally these congregations that they are holding in Tablighi Jamaat, they are responsible for the coronavirus spread. And there was this conversations going on. And of course, there was a huge debate about these people coming from Iran, going to these sacred places and coming back, pilgrimage. So this is something which was like in the beginning, there were no quarantine centers, or there were no facilities. And Shahida is talking about those people who were flying regularly, or they were having some support in terms of finances. But for these poor strata or for these poor people, there were certain quarantine centers, and these quarantine centers were devoid of any kind of facilities. So what we did, there was this one quarantine center in Peshawar. So we asked the friends for donation. So the money was collected for them, and then we bought food and other things for these people who traveled to Iran and came back, and they were quarantined without a food, without a proper bedding, without even toiletries. Even the bathrooms are not in that condition to be used. So these were the vulnerable people. These were, and for these, if I take the debate to the violence, like. And that's why when they are quarantined in such a subhuman situation and then they went back homes, they became violent and they started having these psychological issues. So when I was collecting data and working, it is ironic to find out that most of this violence increased because of this migration back to homes with no jobs, plus amongst those internally displaced people, or those people who were kept in these quarantine centers by the government. I'm not talking about those people who could afford a hotel, who could live privately, who had some security in terms of having access to a SaaS program. I'm talking to those about those people who were vulnerable. So in these quarantine centers, at least from my field work, from my data, from the people that I have access, I didn't see. I myself collected donation for these, I would say, vulnerable people, because they visited Iran. And when you go to these pilgrimages or these places, specifically to Iran, even the poorest can go because there is a bus going, and somebody would say, "Okay, you come along, I'll support you." And when they were coming back, and somehow this pandemic broke out, and then there were no place for them. There was this man from Gilgit-Baltistan who was without a passport, without clothes, to change clothes, without any money. And then we had to collect donation for him, and then gave him support and help. And even we paid for his ticket to Gilgit-Baltistan after he went through this quarantine period. So for vulnerable group, for vulnerable people, I would say this pandemic was, I would say this pandemic created a shadow pandemic in sort of hunger, poverty, and it increased their problems. So pandemic was there, and when I was talking to many of these people, they would say, "No, we are not scared of corona. We are scared of not feeding our children. We are scared of not having any food for tomorrow." And that's why this gender-based violence also increased in different households, which is United Nations called it as a shadow pandemic. It was not happening only in Pakistan. In Pakistan, it was, as nobody was working, nobody was even paying attention to these migrant people or internally displaced women. So nobody bothered about them. But if the UN different reports were saying that this increased gender-based violence is a shadow pandemic now. And in KP, like majority of this gender-based violence victims were either internally displaced women or migrants of Afghanistan or refugees living in these cluster camps, or in these areas, or within these very poor communities. So when you approach them, then they said, "We are dying of hunger. It's not the pandemic. It's not coronavirus. It's the lack of funds and food and help, which is killing our children." And that's why we concentrated more on the gender-based violence. Why? Because we felt that whatever was happening to men, whether it's overseas men losing jobs, or people involved with the informal economy, in the informal economy, or these daily wages, you can gauge the level of the poverty and the level of the frustrations and anxiety when you go into these households and when you talk to these women, and then they will tell you what was going on. And it would be very interesting to know that most of these women that we approached, a victim of the domestic violence, they said that it's normal, it's okay, we are fine with this violence. And I asked why. Their reply was that our husbands and our brothers and our fathers are jobless. We don't have jobs. And unfortunately, there was no support for them. And that's why they became vulnerable, more vulnerable than anyone in Peshawar Valley or in Mardan or in Jarsada or in KP. I would say they were not even, when they were in their own tribal districts, they were not that vulnerable, because a pandemic was fine, the jobs were closed, but they were living within the communities. So the communities would come forward. They were living in the tribal setup, so they would come forward and help each other. But then the government was completely indifferent to these newly merged tribal districts.
Can I actually bring on to this point, because I think both you, Dr. Noreen, Naseer, and Dr. Shahida, Aman, you both kind of raised this point that, of course, there is this longer term issue, of course, within KP and Khyber Pakhtunkhwa and the former tribal areas of structural kind of discrimination that has the legacies of both the colonial state and the process of colonization, colonialism, and of course of the post-colonial state, where of course the inequalities that were of course legalized in the case of the former FATA areas, and uneven development that has kind of like shaped the region, has of course affected how it's been able to develop and how it's had abilities or inabilities to access education, healthcare, and the like. And of course, this is something that seems to be becoming more kind of intense in moments of crisis, of course. And of course, in 2018, you have the merging of Khyber Pakhtunkhwa with the tribal areas. And you've both mentioned these longer term structural factors here. And you've also mentioned the fact that, okay, there is kind of still the merging has a huge kind of like burden in terms of infrastructure and resources. And it's still kind of something that's in process and is not really effectively happening as it should. How is that being perceived, and how is it felt by ordinary people in everyday life? Because clearly it must also be a source of frustration, both of these factors, the slow pace of the merging and of course the longer history of structural and direct violence in the region. So I just wanted to hear a little bit about, is that sense of frustration, we can see it taking places and being expressed, but is that palpable? Is that something that we can say we can feel?
Well, I would say that somehow it's of course it's a very slow process. The government promised 100 billion rupees for its mainstreaming of this newly merged tribal district. But unfortunately, as Dr. Shahida pointed out, that Pakistan itself is now struggling with economic recession and economic problems and drought and other issues. And somehow the process has slowed down. And then we can now hear voices from the students union, from the women groups, from the different academia. And unfortunately, the stakeholders are now waiting for this opportunity to state that this merger has failed. And now I've even heard people talking about, and it was during the pandemic as well, when they were ignored in this SAS program. And then later on, when we made the civil society of tribal areas made a hue and cry about it, then the SAS program, some of the districts were, or some of the tehsils were addressed. But it feels like as if the bureaucracy of Pakistan wants to fail this merger, because we saw, as the bureaucracy was responsible of distributing help and aid during this pandemic, we saw that response very slow. some of the rations given to them were in their stores, lying there, rotting, and there was no response. The concerned DC would not even come out of their homes. They said it's a lockdown and the situation is different. So what I felt in my district, that Parachinar was the most hit by the coronavirus. And every day there used to be somebody dying in a village, and we would be coming to know that, okay, that person died. And then of course the stigma attached to it, many of the people were not even disclosing that he is dying of corona, or he died of this virus. So what happened, that the government response, specifically I would say the bureaucracy, and unfortunately the social welfare department of Khyber Pakhtunkhwa in the beginning was declared as a non or unimportant department. And later on, then they realized that no, it is important to include them, because we have to distribute this support or help through a social welfare department. And in these newly merged tribal district, there is no social welfare department office. Even they started this helpline when we started this demand that there should be some helpline, the people should call you. And then with the help of the United Nations Women, they started this one helpline, and that helpline is open for everybody, not for women, but for anyone who has this issue and who has a problem, or who has not been reached out. So unfortunately, these social welfare department offices are not there in newly merged tribal districts. And you know that connectivity is a major issue of the newly merged tribal district with the Khyber Pakhtunkhwa offices. So sometimes, in most of the cases, many of the people who wanted to approach the social welfare department or this disaster management department, they were also given this responsibility. They simply could not reach out to them. And that's why we see that it is very important now. Even during this pandemic, we learned so many lessons. And one of the lessons is that now it is very, very important to speed up this mainstreaming of newly merged tribal areas. It's merged now, so mainstreaming should be done. They should be, the judiciary is there, police is there, and they have now elected people in the provincial assembly. But the government needs to speed up these other, we can say the line offices, the line departments, that they should be made, or they should be also there to reach out at least in times of crisis. And we will be facing another crisis soon, and that would be in the form of floods. So, and then there would be no one to reach out to these people. So pandemic has, I think, taught us many lessons. And one of the lessons is that we should now start working on extending these line departments to these newly merged tribal districts.
Yeah, thank you, Dr.
Can I add something?
I exactly. I mean, I just want to tie in that this is actually tying into a question that's been raised by one of the audience members. So, you know, all of the audience members are welcome to invite questions in the short time that we have left. Yeah. But they are asking basically this question of, you know, what are the longer term impacts of COVID on security and mobility in the region? And then, of course, you're bringing up this brilliant point of like how it is affecting this kind of merging process, how it must, of course, speed up. I mean, it's something 70 is quite late anyway, but it should, of course, be kind of speeding up right now as well. So Dr. Shahida, if you please add to that.
Yes. Yes, I would agree to your assertion, Dr. Sanaa Alimia, to that of Dr. Noreen, that there has been a long-term structural violence against the borderland people. I would say this particular notion of structural violence was not just limited to the state of Pakistan, but of course it preceded it. The FCR is not something that was devised by the state of Pakistan. It was, you know, a colonial legacy, which continued after the state of Pakistan came into being. So in terms of course, a denial of mainstream judicial structures to the to the tribal people, as well as their education, their health statistics, their statistics of employment being far, far behind than the national average, and also that of the context of food insecurity higher, and that of acute malnourishment higher among the children. This and add to it the particular socio-cultural structures discriminating against the women, the tribal women, which Madam Dr. Noreen Naseer has worked extensively on. I think all of these combine to create a sense of strong resentment, I would say, among the tribals who are now part of Khyber Pakhtunkhwa, of course, but just by making the tribal areas a part of Khyber Pakhtunkhwa does not mean that their socioeconomic indicators would change. The government of Pakistan has to sincerely work in that context, and it has to show a sincerity of purpose to change the situation on the ground in the context of course, as Dr. Noreen Naseer pointed out, devising specific programs for the socioeconomic and political uplift, and mainstreaming of also the female population in the tribal areas. Add to it, of course, as you pointed out, that there is a sort of resentment towards being lagged behind than the national average. And as we talk to the FATA students who are there in University of Peshawar and outside, we come to realize that this particular awareness is growing by the day. And that is the reason that, as you understand, social movements are also gaining strength on the borderland. But after having said that, of course, as pointed out by Dr. Noreen Naseer, that under COVID situation, in this pandemic situation, it's all the more essential that the state of Pakistan should provide special programs to ensure social security coverage to the vulnerable people in FATA, inclusive of their female. Because, you know, the SAS program, which is a social security provision program for the vulnerable under COVID, they are for only those people of Pakistan who already have valid ID cards. And all of us, or some of us would know that almost 2 million women in Pakistan do not carry valid ID cards. So if we ignore the plight of these 2 million women who are already, of course, they must be the one who belong to the lower middle class or to the lower strata of the population, then it means that we are ignoring a very important reality of our life. So what else were you talking about, Dr. Sanaa?
No, I think both of these points are quite important points. And I think what I was hoping to get as we kind of closing up the session really was just this indication of what the legacies, I guess, of this pandemic will be. I think, of course, as we know, it's reshaping our world as we know it generally. And until there's some situation or some kind of vaccine, our lives are, of course, affected. And there are those people who are, of course, in more privileged positions and who can navigate it with somewhat ease. And then those persons and countries.
Can I add one point here? You were talking about what the government can do, or we were just talking about what the state of Pakistan can do to alleviate the sufferings of the internal migrants and overseas migrants. I was just reading in the newspaper for the last 2 days that thousands of overseas migrant workers are, you know, they are stationed in Peshawar, and they are visiting the PIA office every day in order to get their flights confirmed. And since new regulations have come into force, which mean that they have to provide a certificate to the Saudi government that they are corona-free, that is why they have got additional financial burden on them for taking the test from private laboratories, which is costing them 8,000 to 10,000 rupees. And these particular set of overseas migrant workers, they are really hard pressed on their earnings, because they have almost reached the end of their whatever savings they had, and they need to go back to the places of work. And here the government of Pakistan can really interfere to provide extra flight services to them, because currently the demand for flying overseas is almost 3 to 4 times higher than what the Pakistan International Airlines is providing to these overseas migrant workers. And their condition is really heart-wrenching, because some of them were crying when they were talking to the journalists and to the media personnel as to how they don't even have now the money to buy food for themselves, because they are stuck in Peshawar, and they are trying to confirm their flights, and which are, of course, because of the shortage of flights abroad, they are not being confirmed to them. So this particular, I think these are, for the state of Pakistan, these are small steps which can be, which, if taken in the right direction and with the right zeal, can create, generally speaking, a very good impression among the migrant workers, especially the overseas migrant workers.
I just have one question, perhaps to both of you, that you could to touch on, that's come in from one of the audience members, is just asking that, of course, in the current moment, and I think you've touched upon this by saying that 2 million women do not have access, or do not have, they're effectively what you would call undocumented natives, right? A term from Al Sadiq's book, Paper Citizens. But there is, of course, an expansion of the state then in some regards of producing identity cards and being able to kind of have these ID cards and have documents. Is this something that it's an expansion of the state to help and provide relief in a way? Is there any slight suspicion on persons with regards to kind of like having to have documents, for other reasons? Is this another form of surveillance that perhaps people are wary of with regards to record and data keeping and data confidentiality? So this is a question coming in from the audience. And Dr. Noreen, maybe.
Noreen, would you like to answer it? And then I can also add something.
Well, in case of tribal women, I would say that we only get an ID card if we are traveling for Hajj, for pilgrimage, or we are going to some sacred place like Iran or Iraq. Yeah. So I would say that almost, and then I think displacement did one thing. I think development was that for food and for ration and for assistance and help, then many women came forward. Those women who are heading the families, not the woman who already is having a male member who is the head of the family. But a woman who are heading the families, they had to come forward, and then they made these identity card. Even the Benazir income support did not push them to have these ID cards or to have some kind of, because they were living within their communities, and of course, cultural violence is huge than anything else. The state is very small in front of the cultural violence that they are facing at the moment. So I don't think so that state has any intention of surveillance or anything like that, nor any other agenda, because I would say that these tribal women are voiceless, and these tribal women, of course, count me out, but most of them don't get their identity card unless and until they don't have any birth certificate. Even I don't have a birth certificate because I was born in Kurum. So I don't have a birth certificate. So they don't have any birth certificates. They don't have any ID card unless and until they are old enough and they are traveling for either Hajj or Ziyarat, that we call it, visiting the sacred places in Karbala and in Iran. So as long as in terms of the woman presence, and of course, no survey has been done on this, on the absence of the tribal woman, and there's nothing been done. No initiative has been taken by the state to conduct a survey. That I don't know how come these. I believe these 2 million women. I think half of them would be the tribal woman. As you know, we are now 49.9% of the total population, which is counted in this last census.
Census.
So I don't think so that this, but most of these, I think most of these women were facing problems even in their own tribal district by reaching out to the government or any government official for help and assistance because they didn't have any identity card. And it is very ironic to find out that if a man is having two wives, then only one wife would and the family would get the help under the SAS program if he or she is registered somewhere in these tribal district. Otherwise, the second wife and the children would not get any help. So this is something which is of course very complicated and very difficult for the state and for the government, and as well as for even us, those who are working in the field and reaching out to them, or for these charity organizations, that how to solve a problem. Because there was this one man who had two wives and they were living separately. So they had a different kitchens. So that man was then reaching out to us, and he said that under SAS program, I was given a ration for one family, and I'm not given the ration for the another families. And then we had to provide it for it, because of course we don't go into that debate or detail of why you are having a second wife. It's very common in the tribal areas, men having two or three wives, and when they were living in the communities, they were more protected, and of course they never felt the need of having any identity card for the reason of assistance. I think war has really shaken up their social structure as well, and their systems as well. So now I think in future no tribal man would take another wife, because if he is facing these kind of problems. And that's why when we would go to such kind of households, we would find two women fighting with each other on the ration that was given to this one family, which was at that time, we would laugh about it as well and extend a help to the other family. But then of course these are very, very complicated issues that needed to be dealt. And I again say that the bureaucracy, which is a colonial legacy, played a very I would say a very strange role in extending help to these people in the respective districts. Even today, if you go for the identity card in the respective tribal district, either in Kuram or in Orakzai, because I most of the time visit these agencies, tribal areas, due to my relatives or my families residing in these two tribal districts. So they are always complaining that it's the same system. If we cannot have an identity card, there are so many questions and there are so many details that they don't want to bring their female, even if they want to make a identity card for their woman or for their daughters. So there are so many, and it's so red taped for them that they had to even take a security clearance in some of the cases. And for that, they say, okay, why should we then make an identity card for a woman if we have to go through these kind of checks and we have to go through these kind of issues? So that is also one of the reasons. Those who want to make an identity card for their daughters or for their wives, they are facing now another set of problems, which is, I think, a bureaucracy plays a very important role in that.
Yeah, thank you so much, Dr. Noreen and Dr. Shahida. I think it's a really interesting point for us to kind of end on, because of course we're talking about migration, mobility, and how communities are of course affected. And what we're being left and ending with this discussion, of course, is looking at the legacies of colonialism and the post-colonial state and the bureaucratic structures, and how these really are affecting people's day-to-day lives, particularly women's lives and gendered lives in these areas. I think, unfortunately, we are out of time, and I know that we had more kind of like questions that were coming in from the audience. There are so many nuggets and bits of information that the two of you always are able to provide that I feel I could certainly carry on talking to you both for another hour, and I may ask the host of this meeting to allow us to continue using this this forum just for a bit more of information. But for now, I'd really like to thank you both for your time and for your insights, because I know that both of you have done yourselves a lot of work as individuals and as collectives and with other people, and are of course drawing from your own experiences of how not only the pandemic but broader kind of systems of governance and of forms of structural violence are affecting the communities and places that you work in, and of course are intellectually and analytically analyzing as well. So I would like to thank you both. It's such an honor to have two wonderful scholars from Kurum and from Chitral via somewhere else, I think, Dr. Shahida, as well, and from the University of Peshawar, and speaking with us today. So thank you so much for your time. And I hope that we can invite you back for another discussion at some point in the future that expands on your own work as well, in their own respective regards. I'd like to thank all of the audience who were joining us on the live stream as well. Thank you so much for your questions, and apologies
Thank you very much
that we weren't able to take.
Thank you very much.
Thank you very much.
Thank you very much for inviting us. Thank you.
Bye.
Take care.
Allah Hafiz, everyone. Bye-bye.